Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is commotion retini and macular hole. A 27 years old male patient presented in emergency with history of trauma to the right eye by football almost 1 day back. His visual acuity at presentation was counting finger 5 feet right eye, left eye was 20/25. Anterior segment, both eyes were normal, but on examination in the right eye, there were diffuse retinal hemorrhages, extensive commotion retini, and left eye fundus was normal. So this is the fundus photograph of the patient. You can see that there are diffused hemorrhages throughout the retina, and the macula is giving a dull appearance over there. Let's see another slide. Here again you can see commotion retini, how extensive it is going on. This is another retinal hemorrhages with commotion retini. This is another site, extensive hemorrhages scattered throughout, even going into the periphery, and whitening you can see over there in the retina. This is the left eye, absolutely normal, macula, retina flat, no hemorrhage, so it was normal. So we decided to investigate this patient. My main concern was to rule out a retinal detachment. So along with this fundus photography, I advised OCT and B-scan. The reason was there were so many hemorrhages over there that I wanted to be sure that there is no retinal detachment in periphery, which I do miss. So when I did see the results, you can see that there is a full thickness macular hole in the right eye, with localized under it some detachment over there also. Please remember that it is a 1 day history. This is another image of OCT macula. You can see the macular hole and the retinal localized under the macula. There is detachment also. Left eye, OCT macula, perfectly normal, no edema, nothing, good contour of the fovea. So this is the B scan. They ruled out anything, just they mentioned some vitreous haze and retinal thickening they did mention, and optic nerve was normal, no avulsion, nothing like that documented, and no retinal detachment basically. So this is a case of commotion retini with macular hole. Commotion retini is basically retinal whitening due to extracellular macular edema. It may be localized or diffuse pattern and usually affects the inferior and medial aspects. As you can see in this case, in which we have got macular hole. So usually the macular hole develops when the photoreceptor's outer segment and retinal pigment epithelial interface is affected. It is believed that mechanical distortion of the retina relative to vitreous and sclera leads to disruption of photoreceptors and formation of full thickness macular hole. Another reason is that the photoreceptor's outer segment level at the fovea has the least support from the Muller cells, and they are very prone to deformation. So these patients, usually these macular holes are self-healing. They heal after some time, and usually topical steroids can be prescribed to these patients in tapering fashion over a period of 1 month. Some people have tried vitrectomy and they found very good results, but we believe that vitrectomy is suitable for mild cases. But as you can see, the level of damage done in his right eye due to the football injury, extensive whitening, and the macular hole, full thickness, it leads to a question mark about his prognosis. And the final visual acuity of this patient will depend, how much photoreceptors damage has occurred in that area, how much pigment atrophy has occurred, and later on how much clumping of these photoreceptors and pigments occur at that place. So basically, to mention this case is that we quite frequently see these patients chemotherapy, but this was a little bit unusual because there was a full thickness macular hole. Number one, and number two, the decision to operate these patients can be done on the basis of OCT, because OCT actually gives us an idea the extent of damage at the photoreceptors and RPE level. Thank you.